Shernaz, my last question to you would be that, as a counselor, I'm sure you would have come across very number of times extreme circumstances, while you're on the phone with somebody or in person as well. So what has been your experience as you were handling such extreme cases?
Yes, Sonali, I think countless patients, innumerable times, especially when you work with the suicidal, that you would come up with these kind of incidents.
Right.
And every single time, I think the first thing that has worked is listening.
Okay.
I keep on this word, but that is the base for listening. Listening actively and calmly.
Right.
Allowing that person to talk it out, to vent out all those feelings, and as far as possible, not interrupting it or her.
Right.
I have had clients who have called up saying that they are standing on the edge of the beach. Wow. And about to walk in. Okay. Or have called up with a bottle of sleeping pills in their hands. Mm-hmm. So I think it's very important first for the counselor to be calm. And not react to that situation, because the person, from the counselor's body language, the tone of voice, the facial expressions, the body posture will pick up. Correct. The tension. Correct. Or the calmness, and that, what we call as pacing, helps the opposite person calm down if you are calm. Right. Allow the person to talk. Very often, if a suicidal person, okay, it is not a suicide for us is a cry for help. It does not mean that the person really wants to die. Right. Even if they are talking of death, they are thinking of death. It is basically to escape the pain that they are going through. Right. And they feel that there is no other way out. Correct. Right? So, allowing them to talk it all out. Mm-hmm. Asking maybe a in between pertinent questions, which allows them to talk more and open up more. Once that impulse passes off, this conflict that they have between wanting to commit suicide and wanting to seek help. Right. That impulse is not going to stay forever. Absolutely. Helping that impulse pass off is the first step. Okay. Having said that, if the person has already attempted suicide, I don't think at that point in time the counselor has any role in it. Right. It is a medical emergency. Patient needs to be hospitalized. Right. Needs a higher level of care, needs inpatient treatment. And after the person or patient has stabilized, then therapy is useful in figuring out, obviously the underlying causes, the thoughts, the behavior, emotions, whatever. Right. So in terms of extreme instances, the first thing the counselor can do, and also it is also important that the first thing the counselor does not turn around and say, oh, this is serious, this is an emergency, you go to the hospital, you go see a psychiatrist, I can do nothing. Basically, I think what is important is to give hope to a person. A suicidal person has lost hope in all ways. True. His coping mechanisms have fallen short of the stressors in his life. Correct. So hope is not giving false promises or making false promises or just turning on saying, don't worry, we will sort out everything. Mm-hmm. But that there are other options. Let us look at other options. Suicide and death is not an option. Correct. So to begin with, I never turn around and say that, don't commit suicide. Right. I always acknowledge the feeling of suicide, that yes, it is an option. Right. Killing yourself is an option. It is your life. It is your choice. Absolutely. But let's talk more about it. So true. So basically, what it would be that, instead of cursing the darkness, let's try and light a candle in that darkness. Correct. That's the kind of hope that I'm talking about. Right.
So engaging with the person in a continuous conversation very calmly will actually help, to ease out that pain with time of your, the longevity of your conversation with the person. And perhaps, obviously you can't expect that person to suddenly flip and start thinking rationally. But yeah, maybe like you said, your listening will help him to start listening a little more as well. Right?
The empathetic listening is what
Yes.
helps the impulse to pass off at that point in time.
Perfect.
But if the person has already made an attempt, then it's a medical emergency. There is no other way out than hospitalization for that time being.
Okay. And then how soon that, that after that, then you take over the person for continuing the, the therapy with the person, or they have a choice whether, they want to kind of take their time then to come back to therapy.
Absolutely. Once they are stabilized with the hospitalization, they obviously are, going to be seeing a psychiatrist regularly. The hospital there, itself may have a counselor.
Correct.
They may see a counselor there, but if they have had a rapport with you, you manage to build a rapport at the time of a crisis. I found very often that, once they are a little better or they have been discharged from hospital, they will come back for therapy.
Okay. Perfect.